All right, Dr. Emer, we're live.
Hey guys, it's Dr. Emer. We're in the OR and our patient just had an upper bleph from one of our plastic surgeons. I'll show you guys really quickly. She had upper eyelid surgery. We removed the upper part of the skin on her eye. I can actually keep this down a second. And now she's asleep, and so we decided why not treat her acne scars while she's asleep. So we're using the Pixel 8 Roar device deep microneedling radiofrequency. You can see how powerful this is with the amount of bleeding it gets. This is allowing me to puncture the skin traumatically with a little bit of deep heating, and this is going to be right before we start the laser process. So we are going to do a CO2 resurfacing today. Perfect. And again, we just did, this is a great example of a quick surgery that you can have that gets you what you want, which is the upper eyelid skin removal really earlier in life. And then at the same time, why not treat the scars? And so here we are with the deep microneedling.
Poor connection.
What?
Okay.
And so the good thing is while she's asleep, she will have minimal pain. Oh, we don't have our microphone. But I can do a lot more aggressive. So we have a little bit stronger than normal on her today. And this deep microneedling is a good starting point because we're going much deeper than the laser does. For the laser, this is going to get the undersurface of the skin.
Does the patient have to be sedated for this? No, guys.
Oh,
we
no.
do this in the office all the time if you follow us. It's just convenient right now for our patient. She had her upper bleph done right now under general anesthesia, so she's asleep right now. She's not feeling anything, but we do this in the office every day.
Exactly. So it does hurt. With this one, we tend to do nerve blocks at the settings that we use because we go really strong. And remember, all my more sensitive skin types, can you guys move the tube? All my more sensitive skin types, like more olive skin tones, those with rosacea or ethnicity, mixed ethnicity, we will pre and post treat their skin. So we actually did a pre-peel for her. It's on our Instagram feed. Check it out, where we did Cosmetic peel, our lightening and exfoliation peel with my very detailed regimen, okay?
You have Fab Obsessing, the Dermatology best, the skin god.
Love you guys. Thank you. Miss you. Fab Obsessed, you better get here soon. We have a lot to do with Emerage skin.
Really saying how she looks fantastic. They want their eyelids done too.
Yeah, it's
guys.
Such a good young person's treatment. We have plastic surgeons that do that. Jordan can tell you how to make the appointment.
Guys, send us a DM, full name, email, phone number. We'd love to reach out to you guys. We have some amazing plastic surgeons we work with for face surgeries, for body surgeries. We do everything you guys can think of in our group.
Exactly. And so, I'm doing a double pass on the deep parts of her cheek, and we're doing along the jaw.
Can this be done on the body?
Yes.
Yes, guys, we can do this.
Go ahead.
We can use this everywhere on the body, guys. We do face, we do neck, we do it on the body. We've done it on the abdomen before to tighten up some loose skin. People have done it on the
knees.
Elbows, knees, buttock roll, guys. We do
Love
this
it for
everywhere.
creepy knees. And so now we're going to just keep it going, and we're going to follow this treatment with CO2. Now she's been prepping emeragecosmetics.com.
Good viewers.
So you guys, you can go to emeragecosmetics.com and do a virtual consult. Even if you're not living here, we can get you on the skincare that you need before and after. I just posted a video about a guy that had a peel and had a lot of irregular texture and peeling post-peel. If you had done a very specific skincare regimen and protocols with stem cells and peptides and exfoliation enzymes rather than picking, you can get a much more amazing outcome. And so we can set that up for you virtually. Tell them how to do that.
Guys, send us a DM, full name, email, phone number for any of those concerns. If you guys want to look at our feed after this, we did post her result from her peel, guys. She used our lightening and exfoliation peel to prepare her skin for her laser treatment she's doing today, guys. She saw a great improvement, that her skin looks a lot better And it's like even better after she heals from this laser.
And I have a lot of patients that say that they didn't get the same result from the peel. And I asked them, well, where did you do the peel? And they said, not with you. And I said, well, that's because you didn't do our pre-peel, our post products. You can buy the kit. The kit's not enough. There is an entire post-care protocol that we use with Cosmelon and with Enlighten that enhance the results. So anyone showing the results of those alone, they're not getting the full effect if they're not doing the Emerage Cosmetics, Emerage Skin protocols that we have post-treatment.
If you ask me, what are we doing, guys? We're doing our Pixelate. This is our microneedle with radio frequency from
I'll show you guys
Aesthetics.
here.
Check it out.
These are going into the skin deeply, puncturing those scars. Also, take a look. She just had an upper bleph. So this is a part of her surgery. Really quick, about an hour after getting it done. So she is going to look phenomenal for everything she has coming up, and her eyes will be set for pretty much almost the rest of her life, at least 10 to 20 years. And with Pixelate, you can have coated and uncoated needles, so we can make a choice of what we do in terms of aggressiveness and combination with lasers. All right. And get all the way up there because I want some tightening. Remember, microneedling radio frequency not only improves texture of the skin, but it also improves tightening. And so I like to go a little bit below the jaw and get her a little tightening as well. I'm gonna bring her forward, make sure we hit every area. I can move the tube this way. Over here. Over here. And again, the whole mouth. And then that's it for the Pixel. I'm sure you guys are gonna really love to see the CO2.
Guys, if you guys love this, you're gonna love our CO2. It's coming right up next after we finish this. We're almost done.
This is step
Do you
one.
use insulated or non-insulated needles, and what is your depth? How many passes?
So that you guys have to, that's independent to the treatment, to the person. Each person's different. Can't really
So
give you
guys,
that info.
We'll be sharing that.
Okay, go ahead and drop there. I'm gonna go one more pass above the lip. Everyone likes to make sure their lips lines are improved. And then I like to just do a little bit on the nose to get some pores. You guys could see the stitches are in there. Those will come out in about a week for her eyes.
Do the needles get dull as you continue this?
Yeah, you don't want to do too many areas. 1 or 2 areas to replace the tip.
Why not Pixel on neck, guys? We do on the neck all the time. Our
Yeah.
patient just didn't opt in for that. She could have done it. She chose not to. Today we're trying to address her acne scars, which were on her face.
Right.
Many of our patients who we do our internal heating, facial contouring with either Face Tight or Renuvion, we do follow with our Pixel treatment for additional tightening, and we suggest that as maintenance.
Exactly. So wherever she has the porous area, I'm doing a different setting now. A little bit extra over the porous area here. I'm going to do that same thing on the other side, and then we're going to start the laser. Okay. Very good. So again, this is a great treatment. Whenever you're going under anesthesia, or you want to go under anesthesia for surgery, you can. We can do small procedures quickly without pain.
No pain, very easy add-ons.
This is we do this every day, but it is painful. All right, you guys, I'm going to show you really quickly. That's a very comprehensive Pixel treatment. Perfect. Take a look. That's Pixel. You could see all the deep channels doesn't look too aggressive, we are now going to go and do our CO2. Stay tuned.
Perfect.
Let's take a little.